And the White House is now working to make a COVID treatment pill available to a lot more Americans. Paxlovid from Pfizer has been authorized for high-risk patients as young as 12. It's been shown to reduce hospitalization and death by 90% if taken in the first 5 days of infection. And now that there is a large supply, the Biden administration wants to make the drug available to lower-risk patients.
We want to lower the severity of the disease that people get if they get infected, and we want to lower the hospitalizations. We want to lower deaths.
Pharmacies can order the antiviral treatment directly from the federal government. And for more on the pandemic, let's bring in Dr. Daniel Varga with Hackensack Meridian Health. Dr. Varga, thank you so much for the time. My first question for you is, what is the current state of COVID in the tri-state? Are we seeing more cases factually or just anecdotally? And if so, what do you attribute to the spike?
You know, they are going up, Jessica. We still haven't quite peaked on this. We kind of hit our low in the tri-state area around the middle of March, and we've kind of been very slowly creeping up since that time. It hasn't been kind of that really fast rise like we saw in the past. It really is because the Omicron BA.2 variant is just really infectious. It's very infectious. It tends to cause less disease. And it's really easy to pick up, and a lot less of us are masked.
Yeah, and you know, doctor, in the cases of the flu, generally you get it once a season, then it's gone. Maybe you'll see it next year, but you're done with it. Some people are getting COVID a second time in a rather quick period of time. Do we know anything about COVID immunity and how long it might last?
You know, it varies. You know, there's some fairly good data if you go back and look at the original variant of COVID and people who got sick and how long it lasted for them with respect to getting infected by the same strain. The reality is because we've had variants that keep cropping up, there is some susceptibility. The good news is that both natural immunity and the vaccine seem to really lower the overall severity of disease. For example, right now, even though the cases are going up, the percentage of people that are actually getting hospitalized, the percentage of folks in ICUs, and the percentage of folks on ventilators is really, really low compared to previous surges.
You mentioned that natural immunity, Dr. Varga. Unfortunately, some people are earning that natural immunity right now. A lot of us managed to avoid getting COVID the first time around. Now people are getting it. What should they do? Do they need to go see a doctor? Should they just isolate at home? What would your advice be as sort of a 101 primer for the first time COVID people who are getting the virus?
No, I hear you. It's, you know, we would like to actually see more people getting treated with drugs like Paxlovid. It's really available right now, and it works really, really well. One of the things I think we're seeing is because there's a lot more home testing being done right now, that minimally symptomatic folks, you know, they do their nasal swab, they go, oh, I'm positive for COVID. I'll stay home from work for 5 days, I'll tough it out, it'll all be great. But you really can get benefit from the antiviral drugs. And one of the things I worry about the most is that even with this variant, you can still see long-haul COVID with it. Yeah. Well, that is definitely not good news. And Dr. Daniel Varga, thank you for answering our questions. We'll have a lot more, we're sure. So we could be coming back to you soon. Thanks so much. Thanks, guys. Take care.